be here and to learn more regarding caring for children and youth in foster care. And so today I and Gwen Goodland are going to talk a little bit about the American Academy of Pediatrics best practices for children and youth in foster care. Trying to figure out how to advance my slides. There we go. Okay. So I nor Gwen have any disclosures to disclose to you today. So today we're going to talk about a little bit about understanding the physical health as well as the mental health and educational challenges for children and youth in foster care. And then we're going to look at the AAP and other best practices designed to help address issues faced by these children and youth. So looking at initial and more frequent well-child visits, additional screenings, developmental screenings, mental health screenings, some after-visit summaries, as well as enhanced care coordination. So I know that Shoshana and Gwen touched a little bit about the tele-echo clinic, but just to kind of refresh, it's designed to improve the quality care of underserved high-need populations. This specific tele-echo clinic is going to be running from January today, the 5th through June 8th, and it's going to be meeting every other week from 12:30 to 1:30. So I know just kind of as a reminder, you have to register for each session. So make sure you go back and register for the next session if you haven't already. They're going to be a short didactic presentation, and then we're going to do some case studies that are de-identified. And then we're going to share knowledge just basically as together as peers to better understand the complex needs in managing this population. And it's an all teach, all learn, which means it's going to be interactive, ongoing mentorship, peer-to-peer learning, and some collaborative problem solving. So we have a poll in here, and Shoshana, I don't know if I have to stop screening and sharing in order for you to put it on there, but we'd like for you guys to answer the first question, which is, what role do you have in caring for children and youth in foster care? So you should have something that popped up on your screen and be able to click in your answer.
Yep, it is on screen and people are answering it.
Perfect. And I don't know if that goes to you, Shoshana. Sorry about some technical difficulties, guys, as we work through this, our first section. If everybody said to put their answer in.
They're answering it. Let's give them maybe about 15 more seconds.
Okay.
Okay, I can share it with the group now.
Perfect. So it looks like we have a good number of primary care providers, nurse, and office staff members, but a little kind of in each, except for we don't have any in birth parents, foster parents, or kinship caregivers. So if we look at the next question, we're going to look at, for those that are primary care providers, how many of you currently serve children and youth in foster care?
I launched the poll and they're answering it.
Tracy, I feel like we're so high tech. I'm like so excited.
Well, I'm not high tech. Shoshana's high tech. So let's give her the credit.
Go, Shoshana.
Let's give it another 10 seconds and then I'll stop the polling.
My team members on here are laughing at the thought that I might be high tech.
I'm going to close the poll now. I'm going to share it.
Okay, so a good bit, 83%. So that's exciting. So hopefully we already know a lot, hopefully, and we'll learn some more. And those that don't, we've got a lot to share. All right. All right. So when we look at the American Academy of Pediatrics, it classifies children and youth in foster care with special health care needs. We don't want to look just at their physical health. We also want to make sure that we're looking at their mental health, developmental, educational, oral, and their overall psychosocial well-being. So I think that's really important that we remember as we're looking at this population. When we look at the physical health issues that face this population, about 30 to 80% of children that come into foster care have at least one medical problem. And about 50% have chronic medical problems, things like asthma, anemia, hearing, vision, neurological disorders. And about 40% have oral health issues, with about 60% of children younger than 5 years having developmental health issues, and more than 40% of school-age children having educational difficulties. And about 10% are medically fragile or considered medically complex. So some significant physical health problems facing this specific population. When we look at their mental health needs, about 42 to 60% of children and youth have emotional and behavioral problems. And then one study, which I just think is kind of astounding, the rate of PTSD for foster care alumni was at twice of that of veterans from the first Gulf War, which is pretty significant. More foster care alumni go into prison than college, and about 6% of foster care alumni that have at least some college education, but about 1 to 2% only graduate with a 4-year degree. So I think it's just really important when we think about adverse childhood events and our ACEs and looking at early intervention to help with better outcomes. And though it's really important that we're addressing the needs of children in foster care and meeting their needs to have better outcomes. So the AAP recommends that children in foster care have a health screening visit within 72 hours of placement into foster care. These visits take typically more time and often a lot more research and finding information kind of on the back end to better care for these kids, tracking down records. One thing that I know that within the state of South Carolina, a lot of practices, I know our practice here at MUSC is already implemented. That first visit even break it into a 2-part visit. So we're seeing kids initially and we're seeing them in a month. One, so there's so much to be done, so we're not poking and prodding those kids so much in that first visit, but also allowing kids to settle into their homes as well as also get records and get information to provide better care for those kids. The South Carolina Department of Social Services is recommending, following the AAP guidelines, that we do an enhanced well child visit for these kids in foster care. So typically we see kids that are not in foster care, we see them at birth, and then we see them, a couple days out, maybe a couple weeks to make sure that they hit their birth weight, and then we're seeing them at 2, 4, and 6. But for these kids, as we've talked about, they have increased health problems, and so we want to be watching these kids closer. So from birth up until 6 months of age, we're recommending that you see these kids monthly for a well child visit. And then once they're 6 months old until 2, we're seeing them every 3 months. And then a big difference is once they hit 2, instead of seeing them annually, we're now seeing them every 6 months for a well child visit. And I know we're going to do a talk probably later on as far as billing. Am I correct, Gwen? And we'll talk a little bit, but there is reimbursement for those well child visits. Because I know that's the first question that we usually get is like, who's going to pay for this? And so I think that's one of the things that with the South Carolina Department of Social Services and Select Health, working to make sure that these kids are getting their needs and that the providers are getting reimbursements. And we'll talk more about that later. Gwen, I don't know if you want to add anything.
No, I just want to say there's also, we're going to talk more about this too, and Dr. Wallace is going to help us with this, is there's also enhanced reimbursement for that first visit. That started in July of 2019, and we're super excited about, July of 2020, and we're super excited about that. So you'll have another tele-echo on that as well. And it's to identify, because it takes more research and it takes more time, it kind of helps reimburse you all for some of that.
So like we talked about, these kids have a higher prevalence of healthcare problems. A lot of times these kids are moving homes. Not only do they move homes, they move healthcare providers, so things can get overlooked and get missed. Kids in and of itself, a lot of times we think we move them from a bad situation, everything's great and hunky-dory, but a lot of times it's not. Being in and of itself in foster care can be traumatic for kids and be really hard for them. And so watching and monitoring and making sure that these kids are doing well, it's really important. And we also want to just make sure, because they're moving, that they have appropriate referrals, they're getting their correct equipment, as well as supporting the families, just because, like I said, these kids move so often, they have so many complex needs. We're making sure that foster families, as well as birth parents or caregivers, are available, that they're getting the information as well. So a little bit, I don't want to go in a ton into screenings, but it's just, we'll talk about, it's just really important because of those behavioral mental health problems that we're screening these kids and doing simple things like for our kids 6 and up, if you're using in your office, something like simple as the pediatric symptom checklist. If there's a concern for ADHD, then we're getting appropriate screenings. We're doing our ages and staging questionnaires at the appropriate ages, making sure that we don't have any developmental delays, that we're screening for mental health. It's really important. I know the AAP recommends as far as like adolescents we're screening, but kids, because of their trauma, making sure that we're making sure they don't have any other signs of depression, anxiety, any other concerns. So like I said, just as kind of I went over with this, early diagnosis and treatment is going to be the best and see our best long-term as far as for those ACEs and adverse child events, and making sure that we're getting a loving and nurturing environment and getting the appropriate treatments as possible. A lot of times we don't know a lot about our past, so making sure that we are screening to make sure that we're not missing anything, and as well as just we know that kids a lot of times in foster care can get a bad rap as being kind of naughty because they have all these big feelings and big emotions and have had the bad things necessarily happen to them, and so they have an increased risk for educational or behavioral health issues. So if we can identify things early, can help them be successful in the long run. So I'm gonna let Gwen talk a little bit. One of the big things is making sure our kids from birth to 3 years of age are getting a BabyNet screening, and that's now happening and being made by DSS case managers for all children in foster care, as well as our children that are 3 and up, making sure that they're getting referrals to Childfind, which is different depending on where you are in the state of South Carolina and your school district. But I'm gonna let Gwen talk a little bit about some data that they've already collected.
So thanks, Tracy. I just wanted to tell y'all, this is really exciting for us. When we began working on this issue of making sure that children under the age of 3 were getting a referral to BabyNet, it's required by our federal legislation. We could only document about 20% of those kids were actually getting referrals made in our system. And we have worked very hard on this, and the data that you'll see, the colored bars, just show our progress over in 6-month increments. This is one of the measures that we report to for our federal lawsuit that we have. And it's one of the ones we've made significant progress on. As you can see right now, the latest results that about 97% of our children get a BabyNet referral. And then of those, 87% get that within 30 days and 92% get it within 45 days. And I think that's pretty significant improvement where we've been over the past year and a half. And so there is a good chance a child that comes into your practice has gotten a BabyNet referral, but here's where we need your help. If you're taking notes, write it down. Foster parents cannot refuse a face-to-face assessment from BabyNet staff, and sometimes they do. They're like, this child is fine, everything's fine, and we're like, time out, no, you can't refuse. So if you are talking to foster parents for these little ones and you have a conversation, check and see if they refuse that BabyNet referral, and if they have, help us by making another one. I don't want you just to assume that the BabyNet referral has been made, but just know that we have many foster parents that refuse them, and we have a process to catch that, but y'all can be also a kind of a backup for that as well. So thanks, Tracy.
Yeah, I mean, I think definitely still with ours, we have our nurse still make that referral. I feel like 2 referrals is better than no referral at all, or thinking, sometimes unfortunately, people are busy, have a lot on their caseload, and, we have lots of systems in place now to try and make sure those boxes are being checked. But I think, if you have a concern or know you have a kid in foster care, go ahead and make that referral to make sure that the kids are getting what they need. So just like we've talked about, early trauma and toxic stress, if we don't intervene, if we don't provide that responsive, nurturing environment, then we don't have the best outcomes, and it can affect kind of our brain and our development in general. So early intervention, like we talked about, is just key, and so that we can have better outcomes down the road. So we talked a little bit about mental health screenings. We should be screening all of our kids. Gwen, can you speak to any as far as what's required on the DSS side, on your side as far as mental health screens? I think that's, we're assessing, I think, in the office, but what's being happening on as far as DSS with kids coming into care?
Sure. So right now, what's required is a mental health screening within 30 days. And that's typically done by your community mental health centers. But we're going to be changing this so that every child that comes into foster care will receive what's called a CANS, a Child and Adolescent Needs and Strength Tool. We're going to be implementing this throughout 2021. And what will happen is you'll begin to see those for that initial well child visit. And you'll be able to see those in your practice and know where we've screened a child. So you'll have access to that. And you'll be able to see, oh, this child scored a 3, which was really high. We need to take action on it. And these social emotional issues. And in here is a little trauma module that we did that tells you a little bit what's going on with the trauma piece. So we are required to make referrals for those when we have high needs areas, areas that require action, but this also communicates information to you all about where that child is with respect to trauma and their behavioral and emotional needs. And so just want to make sure you all know that's coming. We'll keep you posted and we'll keep referring back to us because we'll be in the middle of implementation as we work through this teleecho clinic. So that's where we are. The CANS is what we're going to be implementing for children in foster care.
And I would just encourage, just as this is being developed, being willing to ask your foster parents, like, what kind of screening, what kind of appointments, what kind of things have they gone to? They might not necessarily know that it's called the CANS. We're hoping, as far as things roll out, the education, but what kind of appointments have they been to? What kind of, appointments do they have? Do they see a therapist? Those kind of things, making sure that the kids are engaged, as well as just kind of checking as far as overall on their mental health status. Not asking primary care providers to do a full mental health assessment, more being aware and checking in and making sure that those kids are getting what they need. Like we've talked about before, 42 to 60% of children have emotional behavior problems. It's pretty high. And we know that, like I said, a lot of the kids in foster care sometimes can be labeled as kind of that naughty behavior, the ones that are acting out and having placement disruption. So just really important that we're checking in and making sure that we're treating the problem. Trauma can look like a lot of things. It can look like ADHD, it can look like depression, can look like anxiety. So making sure that we know what we're treating and the kids are getting the resources that they need. So some ways as we as healthcare providers can help kind of in the big grand scheme of making sure that kids get what they need is giving an after visit summary and giving it to them at the visit, something that the foster parent or as the DSS caseworker can actually take with them. And these things need to include like the child's name, who the child was, their diagnosis, what treatment has been recommended, any medications, and any follow-up care, and any actual appointments that are on there. So one, if the kid moves placements, we know where the appointment is. If they're still in the area, we can hopefully facilitate continuity of care and the kid getting where that they need to go. It doesn't need to be this elaborate and medical mumbo jumbo, just kind of short and simple and clear instructions as to kind of the next steps that are needed. And I think the one thing is most of us usually are working off an electronic medical health record and can incorporate that into part of it. I know for us here at MUSC, what I took is some of the information that they need for the DSS health passport, as well as some of our therapeutic foster home agencies, all the information they needed and kind of incorporated it into a smart phrase in our electronic medical record. And so basically it just generates most information and usually just have to write a couple things on there in order for the family to know kind of next steps and next actions. So it's something that can easily be done and incorporated into your practice.
Before we do the poll,
on that note, I'm going to turn it over to Shish. Good.
Before we do the poll, we have a question that came up in our chat, and Dr. Kumar asked if the CANS is going to be a one-time thing or if it will be done throughout the course of the case. I couldn't read the whole chat, Dr. Kumar, but just know this CANS will be done every 90 days. And so we use that to track progress over time for a child and family, but we also use it to track progress over specific interventions. So if we're able to see whether our programs are actually working or whether they're getting us, the families, where they need to be. So I just wanted to give you that feedback, and we can talk more about that too, maybe during the discussion period. But thanks, Tracy. Sorry, Shoshana and Tracy.
That's okay. So I think Shoshana is working on getting the poll to come up, but the question is for those that are seeing children in foster care, children and adolescents, how many of you are actually providing a after visit summary with the next scheduled appointment on it? Should be coming up.
Okay, so I've launched the poll. So people should be seeing it. And they're starting to respond.
I love it when we have poll questions.
I'm going to leave it open for about 10 more seconds. Okay, I'm closing the poll. And we'll share the results.
Okay, so about 50% are, and then it sounds like about 10% it doesn't have the next appointment on it, and then about 40% are not. Okay, so about half and half almost, a little more than half. I know there's a couple providers, there's like several from MUSC here on here, and I know that we do, so I hope we're not skewing the results here compared to the rest. It's not letting me advance.
So Tracy, our next slide is about the enhanced care coordination at Select Health and DSS nurses. And so
I'll turn that over to you then.
Yeah, so while we're waiting for the control to switch back over, so we just want to let you all know why that after visit summary with the next appointment is so important. Because we told you about the enhanced schedule that's that's more frequent than it would be for children who are not in foster care. There are two teams that are working on providing enhanced care coordination for children in foster care. And the first team is the Select Health foster care team. They began in July of 2019, and they have 19 full-time staff. And next teleecho on the 19th of January, you're going to hear a lot more about that. And then you'll also hear about our DSS nurses. They began in November of 2019, so they've been at it a little over a year now. There are 6 full-time nurses and 2 temporary nurses, and they track and monitor the after visit summaries. And so one of the things they do is make sure that follow-up care is going to be followed up on, and make sure, and you'll hear a little bit more about that in the next slide. But one of the things that's super important is that we know that that next well child visit is scheduled on that enhanced schedule. So if we don't have the date of the next well child visit, we don't know if it's scheduled or not. And so we've got people, staff, you know, it might be case managers, it might be nurses calling and trying to figure out when the next appointment is scheduled. So those after visit summaries really help communicate with your team over at DSS about what's happening and what needs to be happening for children in foster care. And so if you are one of the providers that isn't doing after visit summaries and isn't providing that next well child visit, I don't want to we can provide some technical assistance on how to get that electronic health record to spit those out for you. Otherwise, there's a form you can fill out. It's a form you have to fill out and by hand. That's a big mess. We want this to be almost an automatically generated process for you. So after visit summaries, after visit summaries, after visit summaries. And we can talk to you more about how you can get those next week to DSS nurses through a DSS dedicated fax line for each nurse. So, and we know more about that next time. And if you want to know why would we need to have these after visit summaries? Well, you've heard about all the issues that kids in foster care have and how compounded that is by moving placements, being reunified with their family even, and all these transitions that happen in their life and how difficult and traumatic these are. These people that care about them and are trying very hard to follow up will be your foster parents and your nurses and your case managers. That helps them know what follow-up is needed. And then it makes sure we document that it actually was received. We actually have in our federal lawsuit, when a well child visit is scheduled, it starts a 45-day clock, and we've got to have any follow-up appointments made within that 45-day time period, and we're graded and monitored on that. That's how important it is. It also helps us make sure that we're adhering to that schedule. We're also graded on that as well, and it helps us to document and monitor the well child visit schedule so we make sure we're up to date. I think it's been a real shift for everybody that these kids get in every 6 months. And I realize it's harder for those older kids. I know I was guilty of it. I have 2 19-year-olds. They're twins. And, it would be like 2 years between visits. And I was like, oh my gosh, how did that happen? But sometimes at that teenage years, that's when they need help the most, because that's when they're struggling the most, I think, with lots of behavioral and emotional health needs. And I think as challenging it is to get those older kids in for those more frequent visits, we really feel passionately about the importance of that. And we can make sure you get paid for it too. So that's the important piece on that. But I think that's it, Tracy, except for all the great resources that you suggested that we let folks know about.
Yeah, so I think just to add on that, I think, I've definitely gotten calls from DSS just to kind of let people know for patients that I've made recommendations for younger kids, older kids that had some developmental concerns and made recommendations. You know, I think as a provider, we get busy in our practice, and I'd love to say that we can follow every kid and make sure they get everything. But this is a kid that like I hadn't seen for follow-up because the kid moved. And so I had Bob Linares from DSS reached out to me and said, you know, hey, you had some concerns about X, Y, and Z. Can you tell me a little bit why this, you know, didn't happen? And I could say, oh, we actually haven't seen this kid. Like, we probably need to track down and see kind of where they are. I've also had, I think since we've implemented the 6-month well check, you know, I sometimes get on the naughty list because I see kids often for different reasons, but I haven't done that kind of well child visit. So I think I know in our practice, we're already seeing the coordination and seeing the help with follow through. I know that there's kids that, you know, I've been really worried about that I've been able to reach out to, just McDaniel. I just totally blanked on your first name. Sorry. I don't know why. And I can't see everybody on there. The nurse.
Karen McDaniel is our nurse.
Karen. I said McDaniel is all I could think of as her last name. I've been able to reach out to her for kids that we're really worried about to make sure that kids are getting follow-up and get their needs. So I know from our firsthand, I'm always seeing the coordination and the benefits, and I'm really excited kind of for future, for the future and kind of to see how the coordination continues to grow and develop. Sorry, Karen, I totally forgot your first name. Apologize for that.
No worries.
And, you know, and I will just say, Karen has done a phenomenal job, but we have a long way to go too. So we are not perfect, but we're in our infancy, right, Karen? Just 13, 14 months old. And I think Karen's had to literally start from scratch, look at best practices, build trainings from scratch, and she's just done a really phenomenal job. So we're getting there. And that's part of what maybe our case presentation can discuss too, is how we can help you more and how we can be a help to your practice. But go ahead, Karen, if you think you want to add there.
No, I have nothing to add. We're here to help, and it's going to be a great year for us all together. Thanks.
So these are just some resources just to kind of share with guys. If you haven't ever gone and looked at the AAP, Healthy Foster Care America, it's a great resource. It also breaks down, we didn't get into the nitty gritty of like labs and some other things depending on kind of what the kids' presentation and things were, but can be a great resource as all these on here are. And I guess I'll turn it back over to Cheryl and Shoshana, I guess, as far as for the case presentation.